Ladies and gentlemen, my name is James. I'm a licensed practicing pharmacist. Welcome back to another episode of Pharmacy for the People, where I try to put your health back in your hands by taking complex health information and breaking it down into bite-sized morsels. In my last video, I discussed the divide that's forming or has formed in our culture between healthcare professionals and patients. I made a case for that divide being largely based on trust. A loss of trust constructed of many elements like miscommunication, misinformation, and frankly mistreatment. One of the purposes of this channel is to help to close that gap between provider and patient, bring reconciliation. I believe that one unifying factor in general terms is that we all want to just enjoy life with the people that we love. And we want to do that without making significant sacrifices to our autonomy or our wallets, right? If you've ever had the misfortune of going to see a doctor and leaving with a brand new expensive medication and brand new restrictions on your lifestyle, then you've probably already asked yourself the question for this episode. Why should I do what my doctor says? You might be surprised that a lot of what I plan to say in this video is going to be as much directed to the healthcare community as it is to us as patients. Because what's underlying this ever important question is motivations, priorities, and trust. This is not a video about doing whatever your doctor tells you to do because they're smarter than you and they know what to tell you and blah, 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 blah. This is about the complex motivational factors that undercut a patient's willingness to trust and the success of a healthcare provider's recommendations. Now then, your health is a conglomerate of your environment, your genetics, and your decision making. Your environment can create health issues without your direct input by getting in a car crash, by being exposed to something toxic. Your genetics can predispose you to having issues like heart failure, sickle cell disease, or lupus without your direct input, something that's just been passed down, unfortunately. But your decisions affect your health too, and that's where we do have direct input. Smoking, diet, extreme sports, lifestyle, etc., etc. We make decisions that affect our health every day. Naturally, these factors never stand alone, right? It's a conglomerate. It's difficult to tell what caused what. Was it your genetics? Was it your decision making? Or was it your environment? I'm not listing all the bad things in life to make you feel glum, I promise. I'm just talking about the arguably inevitable case and cause of illness. But if you do feel that, everything's trying to kill me when I list these things off, then you're illustrating the point that I'm currently trying to make. From the patient perspective, you're just doing your thing, you feel bad, you go see a doctor, and bam! You have a diagnosis. A diagnosis. You're just rolling along and then it hits you. Feels like suddenly having criminal charges against your body. From the provider's perspective, this is no surprise. They've likely seen scenarios just like this over and over and over and over again. It's normal to them. And this is exactly where the divide is introduced. On one hand is a perspective where the disease, the cause, the treatment are all brand new complex bits of information that might affect every aspect of our lives. On the other hand, the disease, the cause, the treatment are all well-known, practiced, and well understood. And the bridge between these two things is empathy and response. Empathy from the provider to perceive and address the monumental change that this may constitute for the patient, and the response from the part of the patient to listen, ask questions, and face the challenge head on. And bear in mind that this pattern exists on a scale, right? Not all diagnoses flip your world over end. You can get a physical from a doctor, you find out you have high blood pressure, it means a lifestyle change and maybe a medication to prevent worse things further down the line. Or you get seen for chest pain and find out that your heart is out of rhythm. It's going to mean changes. You're going to have to start taking a medication to keep your heart in rhythm, and there will likely be new restrictions to your lifestyle. Or you get seen for a headache that won't go away, and they tell you that you have cancer. Your whole life is about to change. The greater the perceived risk of imminent danger, the more seriously we tend to take the news. And generally, the more we look to an expert to help us. So let's look at this pattern on the lower end of the scale, where the danger is not immediately present, you feel mostly okay, and all you have is the provider's word and recommendations for life. What do we do when those new recommendations directly interfere with our wallets or our lifestyle? What if they give you a prescription for a medication that costs you an extra $50 every month? What if they recommend no more salt, no more alcohol, no more dairy? If the cost of the recommendations start you off with skepticism, you might nod and acknowledge what the provider is saying, but are you really hearing them? And have they really communicated why they're making these recommendations? First, let me gently address all the providers in the room. Prescribers, please bear with me here. I am not a prescriber, I am a pharmacist. Though we do educate patients on their medications. And in my experience, educating a patient about their medication goes a long way in explaining the why. When I was in school, I was trained to ask the 3 prime questions, they called it. What did your doctor tell you this medication was for? What did they tell you to look out for? And how did they tell you to take it? Both in and out of the hospital, a large percentage of the time that I ask that first question, do you know what this is for? People can't tell me. They don't know why they're being told to take a medication. To me, this represents a patient's inability to be champions of their own health, right? If they don't know why they should do what we're asking them to do, they might do it for a little while, but as soon as it becomes inconvenient or problematic, they're going to stop. It's possible that either through fear or blind trust or just begrudgingly, a patient will do exactly what we ask them to do, but what happens when it interferes with their quality of life? They experience a side effect. What happens when it's just inconvenient? I submit for your consideration that a motivation born from a patient's own desires and goals will always be more effective than any other motivation. One of my favorite maxims from an old mentor of mine was, a man changed against his will is of the same opinion still. Basically, if you change someone's behavior without changing their motivations, it's always going to be short-lived. So I recommend that when it's possible to at least briefly explain the pathophysiology of what's going on in layman's terms and explain how the therapy is going to help them. Naturally, the health literacy and the disposition of the patient will entirely affect what they get out of the conversation, but it gives people the dignity of making their own decisions. I think it would do us a world of good to educate patients with the goal of them being able to make educated decisions for themselves. Though realistically, I realize that there is a ton of stuff stacked against your ability to spend a lot of time with patients. Your workflow, your time. Please forgive me for being idealistic with this, but I do think that would really help people. And on the terms of being realistic, the second thing I want to mention is that personal connection means a lot. It means a lot to you, it means a lot to me, it means a lot to all of us, right? We as patients may have a hard time letting go of the things that we enjoy, like cheeseburgers and alcohol. But when you can stack those pleasures up against other things that we enjoy, more long-lasting pleasures, like seeing your grandchildren born, seeing your own children grow up, making it to retirement. If you can match a person's personal goals in life with the recommendations that you make as a provider, I think it would at least make it a lot more palatable to say, hey, stop eating cheese. But if you can say, stop eating cheese because, et cetera, I think it will really help. In my experience, being able to match a patient's real world goals with the actions we're asking them to take really helps them to motivate past those initial hiccups of the abstention or new activity that we're asking them to engage in. Of course, that requires establishing those goals with people, right? So have a conversation. Find out what it is that really motivates them as a patient. Use that as a jumping off point. Avoid assuming that the patient would rather live for 10 years instead of stopping smoking. They may not. On a realistic note, I've spent time with those most unfortunate people who don't have families or loved ones, or really much to hope in at all. The loss of hope may manifest as non-compliance, as we typically call it, or it may just be a complete lack of desire to do or to say anything besides being numb. You just want to feel numb because of a loss of hope. So if you have hope for your future and joy in life despite struggles, share that with the people who don't. Give them something to hope in. Remember that the human element of this interaction means a lot. We have hopes and fears and emotions, and we all believe things for other reasons besides just robust data. For all you providers out there suffering from emotional fatigue and burnout because you've offered your genuine care and love for the people you're taking care of, it's been ignored and rejected, and you see the same patients coming back month after month after month after month looking worse, or the same. Please don't stop. It takes a lot of courage to keep opening yourself up to that kind of rejection. Even though it's your job, it takes an emotional investment. I get that. But it makes an impact. Maybe not on the person that you're talking to directly. Maybe it's on a family member who's watching. Maybe it's on a nurse or somebody else in the room who sees what you do. But sometimes all we need is someone to show us legitimate care for us. And on the 100th time, something switches inside of us. Something switches inside of us. And suddenly we can feel that care, and it'll make a difference. So please don't stop. You have my sincere gratitude. And I've seen the gratitude on patients' faces when someone comes in and shows that they care, asks them questions, engages them, gives them a voice. It can do a lot. Whew. Patients! I'm going to talk to all of us as patients now, because at some point in our lives we will all be patients, even providers. We are all the single most important people in the outcomes of our health. Environmental exposures, accidents, unfortunate genetics, we can't control those things, but we can control the decisions that we make. It's your health. You be the champion for your health, which puts you in an awkward position when somebody who's devoted a significant portion of their lives to a topic is telling you to do things that you don't understand. So we can acknowledge that there are certain barriers to your ability to champion your own health, like your general understanding of what's going on inside your body, your understanding of the healthcare system and its catacombs of confusing, convoluted components that just go on and on and on and on. To address those barriers, I recommend both humility and tenacity. Humility in recognizing that a lot of training and effort has gone into becoming a healthcare provider, and these people likely have your best interest at heart. But tenacity in asking your questions. Ask your questions. Make your goals clear to the provider. Sure, your doctor may not have a full hour to explain the biology that's going on inside of your body or the evidence for the recommendations that they're making about the treatment. But in my experience, I would rather spend 30 minutes of time that I don't really have with somebody that wants to know, that legitimately wants to know, than the 5 minutes it takes to just give basic instruction to somebody who doesn't care that I'm in the room with them. And like I said, if your doctor doesn't ask what your goals are, tell them. Make a point to be heard. Make sure you can work together to pair your life goals and their recommendations. You'll both get the most out of that. So take some time and really consider what those goals for your life might be. The goals you'd like to achieve, the people you'd like to love and invest in. Considering your own mortality is sobering work, but your ability to work towards these goals and understanding what your goals are will be a powerful ally in really enjoying the time that you have available to you. And on that sobering note, that takes me to the last topic I'd like to discuss, which is grief. When something precious is taken from us, it starts the grieving process. Losing a grandparent, losing a friend, a parent, a pet. Unfortunately, we're all familiar with the pain of losing someone that's important to us. But the grieving process extends itself even to minor things in our life. Like, you make some plans with some friends and they get ruined. Your most well-laid plans. You may grieve through that. Having a house plant that means a lot to you, you can grieve that. Anything that holds a special place in our heart, when we lose that, the grieving process starts. And the same applies when a new diagnosis or lifestyle changes cause us to lose something, cause us to lose elements of our own autonomy. The feeling of invulnerability or immortality that we've experienced growing up, our perceptions about ourselves and our body, the joy we get from a big juicy cheeseburger and a beer. I keep using that metaphor. I'm sure I could come up with a different one. Depending on the level of life change that a trip to the doctor might bring, you may start the grieving process before you're even out the door. So you may be familiar with the grieving process, you may not be, but I'm about to explain it. But the reason I'm bringing this up is to recognize where you are in the grieving process has a very real impact on the way that we respond to the news that we're given. So the stages of grieving are denial, anger, bargaining, depression, and acceptance. 5 stages. Let's imagine being in the doctor's office or in the hospital, and they tell you, like I previously suggested, that you have high blood pressure. And as a result, they would like you to lose weight through diet and exercise and start a medication called amlodipine.
I don't feel that bad. He's exaggerating about how important it is. I'll agree, like right now, but I'm not going to make a change until it's really serious.
Minimization is a hallmark of denial. If you find yourself talking yourself out of the necessity to intervene on your behavior, you might be experiencing denial in the grieving process. It's also possible it could be attributed to a lack of understanding about why the interventions could be helpful. So if you find yourself in the denial phase while the provider is still available, ask, please ask. Own up to it and say, hey, I really don't want to do this. Can you help me to understand why this is necessary? And if your provider isn't available, there are other healthcare professionals available that might be able to help you. Like, for instance, your community pharmacist. They're there. They're available. It's free to go and talk to them. You can say, you can take your prescription to them and be like, hey, my doctor says he wants me to start taking this new medication for my blood pressure, but I don't really get it. This seems like it sucks. Can you help me to understand why this is important?
This arrogant jerk has no idea what's going on inside my body. He just wants to tell me what to do. I'm not even at risk.
As the fear of loss becomes more real to us, it often manifests as anger. Ironically, that's the arrogance bubble trying to deflect at any cost of rationality the reality that there's a problem and then there needs to be a change. Indignant justification of our own behavior is the hallmark of this one. Hallmark of anger. Typically, we've already recognized the legitimacy of the problem, but we don't like the solution that's being presented to us. So we do mental gymnastics to talk ourselves out of reality. When I was younger, that same mentor I mentioned earlier once told me, your best thinking got you into this. Maybe it's time to listen to somebody else. And he told me that when I was vehemently defending my way of doing things. When I thought that if I just do things my way, things will get better. It was hard to swallow. You might even be feeling anger as I'm listing off these different stages, and you're starting to see a pattern in yourself, but it's making you angry. Please, I'm not trying to single anybody out. I'm not pointing fingers. We all do this. It wouldn't be so easy to characterize if it wasn't such a consistent pattern. Please bear with me.
Maybe I'll take some meds sometimes. I'm not exercising, though. I'll eat a salad tonight.
Bargaining can look very similar to denial in the way that your thoughts trying to justify avoiding recommendations. But you'll concede certain points, but stand firm on others to ensure that you don't have to do anything that makes you really uncomfortable. Likewise, I think understanding exactly why the recommendations are important can help us move through the bargaining phase.
It's over. My life is over. I can't do anything that I want to anymore. I have high blood pressure now, but they're going to find something else soon.
Depression and grieving is when we have nowhere left to hide from the problem, but we also can't fathom life on the other side, so we linger in lost hope. Hope deferred makes the heart sick, but hope realized is a tree of life. There is hope, and you won't go through it alone. Malcolm Muggeridge once said that new news is just old news to new people. Chances are good that even the people around you have experienced something similar to what you're going through. There is hope and encouragement found in community. Open up. Be vulnerable about it. Don't stay where you are.
I've wanted to lose weight for a while now anyway. I don't like it, but I guess I'm glad that there's help.
Once we've recognized the problem, recognize it will take our will to engage the solution, we arrive at acceptance of the loss. Then with humility and determination, you set off down a very slight or perhaps very drastic new path. Denial, anger, bargaining, depression, and lastly, acceptance. There are your 5 stages of the grieving process and how it affects the way that we view our health. A few pitfalls to beware of as you start to examine your own thought life and how this might apply to you. Number 1, it's possible that you may stall in any part of the grieving process. You can get stuck in the anger phase. You can get stuck in the denial phase. Look out for stale emotion processing. It's always more difficult to get through it once we've acclimated to the emotional turmoil. Number 2, look out for reactance bias. One of those pesky cognitive biases I mentioned in the last episode. This particular bias causes us to want to do the exact opposite of something that someone tells us to do. Like, I know I experienced this a lot when I was a kid. I did not like cleaning my room, but occasionally I would come to the point that I was like, all right, it's time to clean my room. This is gross. I'm going to clean my room. And immediately at that time, never fails, your mom would walk by and be like, you need to clean your room. And you're like, well, now I don't even want to. That's reactance bias. Thirdly, the desire for autonomy can prevent us from having the freedom to choose what's best for the many and not just for ourselves. We're talking about our health, so why am I talking about what's right for the many? You see, autonomy from the Greek word autos, meaning self, and nomos, meaning law, is the idea that we are a law unto ourselves. We dictate our own actions and the outcomes of those actions. But when someone else makes a law that governs us, we make decisions with our free will, but the consequences of those decisions are governed by laws. I would submit for your consideration that our desire for autonomy may undercut your opposing desire to love the people who depend on you and who love you, because there are natural laws that govern your body. Sometimes our pursuit of autonomy can prevent us from being there for our families when they need us. We can accidentally become a burden to them instead, or a burden to the people that are around us. Living like there is no natural law that causes our body to decay can leave the people who love us feeling helpless, while we reap the consequences of the natural law. On a practical level, because of the way in America we allocate resources, those decisions that we make will likely affect the society at large too. I don't want to go too deep into this right now because it's not the topic we're discussing, but I see the same people coming back to the hospital week after week after week after week. And your tax dollars pay for those visits when they don't have the means to pay for it or insurance. And before you go pointing fingers at them, remember that we all have the responsibility to make health conscious decisions, and we all have the opportunity to be a burden to the people around us. It usually comes on very insidiously. I don't think that autonomy really exists in this world, but it's a commonly held to ideal. I recommend that instead of pursuing autonomy, we sacrifice it for the sake of the people around us, including the people that we love. So this may sound like a bunch of red herring psychobabble that has nothing to do with patients and healthcare providers. And the psychobabble part might be accurate, but it is accurate in how it applies to us. It applies to all of us. In future videos, I plan to cover individual diseases and individual treatments and why those treatments might be beneficial. So if you came here today looking for that in particular, I am sorry to disappoint. But bear with me, I will get there. We'll talk about blood pressure. We'll talk about amlodipine. We'll get there and we'll talk about specifics. So as a sum up, providers, please give us the dignity of making educated choices for ourselves. Help us to make educated decisions for ourselves. Patients, please ask questions and be the champions of your own health for your sake and the sakes of the people around you. And if while you watch this, you realize that you are in the grieving process and you would like some help, please feel free to email me at pharmacyforthepeople@gmail.com. I'm not a counselor, but if I can help in any way, I'd like to. Okay, so I sincerely hope that this offers a perspective shift from provider to patient and patient to provider that will help to close that gap of divide between us. We all have emotions, we all have perspectives. There are things going on both sides that prevent this interaction from being a really smooth transition. So I really hope that this helps. Thank you for watching. Please remember to ask your questions about this video or anything in general. Ask for episodes that you would like to see. Thank you for watching, and I'll see you next time. Suddenly, when we can match their goals, dang it.